what I can say, it hasn't come in a more opportune time, because a few days from now, the face of the AFP healthcare system will change. If before we are decentralized right now, we are going to integrate every core, medical, nursing, MAC, that's medical administrative core, vet, and also the dental will integrate into one, in which what we call a health service command, and that will be in a few days from now. And its goal is that to align with the future force structure, where we are transitioning from being concentrating on the ISO, which is the internal security operations. We are now transitioning into territorial defense. And because we are being taught how to empower or to enhance our role too, and this is the right moment for that. And we have picked up so many things from that, so that we can enhance our capability in having a health service support to our units. Unlike in the United States, the Armed Forces of the Philippines also has an additional mission, which is we are very involved in HADR. Unlike, I think in your country, you have a different unit for that or organization. In us, we don't have one. It is the Armed Forces of the Philippines who becomes the first responder for the HADR. So all the things we've learned here, we pick up so many points. We could certainly help the Filipino people, especially in the humanitarian and disaster relief. We got to meet other people from your country, the best, I think. The best people there to teach us about things, and we get to exchange ideas and learnings. You learn from us, but we certainly learn from you also. And with that, we develop some partnership and linkaging. So whenever we need each other, we need each other help during disaster or humanitarian assistance, we could surely know how to get in touch with you because of this symposium. Oh, as I've said before, this symposium was already brought up linkaging with each other. So we will get each other's contact information, and we could already know who to contact, And also we have learned a lot, procedure systems, which we have been taught during this symposium. And we could certainly use that during our humanitarian HADR operations. Yes, it's really very gratifying to note that all the healthcare givers in the different armed forces in any other country, we share the same goal. We have the same intention, which is the love for our soldiers, because we know for a fact that these people are the true heroes of our times, because they defend and protect our nation. They let us sleep, our family. They let us sleep well at night because they really differ or really protect us from the enemies. And it's gratifying that as a healthcare provider, we find ways and means to make sure that they do their best, that these soldiers do their best well.
Balikatan is a good opportunity for us to bring these medical professionals from different countries together, share best practices, so that when there's an event in the area, and this is an area of the world where there's lots of natural disasters, they have a chance to have met each other and can do a better job. I think it's important that any kind of an engagement that we do with our Filipino partners have some benefit to the people of the Philippines. And I know that in addition to just cementing the friendships between our countries, it's a good opportunity for us to learn a little bit about Filipino culture, for us to learn a little bit more about how medicine is practiced in the Philippines, and for them to have an opportunity to learn how we practice medicine in the United States, particularly in a military setting. This is the first time, to my knowledge, that we've been able to bring some partner nations together for Balikatan in the medical arena. Usually we've worked with the Armed Forces of the Philippines, but this year we have the opportunity to bring in Australians and Japanese. And I think that's a great opportunity to cross-level the deck with medical care in the area here. The support to humanitarian assistance and disaster relief is one of the focuses of the whole Balikatan exercise that we do. And I think that it's been beneficial to the Philippine side, and it's been very beneficial to the U.S. side as well over the years. But I would have to say that the opportunity to reformulate friendships and to mingle with colleagues that we've met in previous years is a tremendous help when an event happens in the area, natural disaster, typhoon, earthquake, and we need to work together quickly. We've already met each other. And so this is a great time when there's low stress to re-cement those friendships and meet our colleagues again. I think that the relationship between the Filipino people and the American people has always been strong. And these kinds of exercises really help me to understand why. The Filipino people are just extremely friendly, they're open, they make our time here so pleasant, and we learn things from them, they learn things from us. And to me, that's just the epitome of global health and the opportunity to learn best practices from colleagues around the world.
Actually, we are first time joined Balikatan exercise 2017 as a Japanese delegation. I convinced father strengthening of know each other through this medical symposium. It is a very beneficial event for us too. This share medical information and the capability is very important for partner nations. So about humanitarian support is this medical symposium is beneficiary for partner nation too. We should cooperate for the common purpose of international humanitarian support.
Anytime that medical professionals get together, there's an opportunity to learn from one another. And here we have both the Philippine nationals as well as the United States participating, the Japanese and the Australians. We believe that this provides a great opportunity for passing medical knowledge back and forth, and the Filipino people will be served well by having that knowledge in their surgeons and physicians as for the next time there's a disaster that requires response or a humanitarian assistance mission that needs to be done. Balikatan 17 has an opportunity to provide great impact to international partnership. We have the Australians, the Japanese, the U.S. and the Philippines represented here. This is an opportunity to become more interoperable, to understand each other better, to have a chance to exchange ideas and learn how to work with each other in a time that's not related to disaster, not related to contingency, so that when conditions change and there is a disaster, there is a contingency, that we are more able and more capable of working together in an interoperable fashion. Balikatan 17 provides an excellent opportunity as well to work in the humanitarian assistance and disaster relief arena. We have 4 nations represented here, all of which have had great experience in that type of work. We all know that the Philippines is on the ring of fire and has had many, many natural disasters over its history. And we think that this is an opportunity that our that the U.S. people, Japanese, Australians, and Philippines can get together, exchange ideas, and be ready to respond in a more interoperable fashion for the next disaster that might strike.
Today was the first day of the surgical symposium with the Balikatan 17, and apart from having the usual introduction and getting to meet the members and representatives from the other countries, it's a multinational exercise. We've got obviously primarily from the Philippines and from the United States, but we've also got representatives from Japan and from Australia. We have started with discussing delivery of specialist trauma care within the forward environment, within a battlefield environment, and have been discussing different nations' military approach to delivery of those trauma care services. I think the sort of multinational conference and symposium is of immense value in that it allows that cross-fertilization. It allows us to discuss the different approaches that our individual countries and individual forces use. And in doing so, we can both align our services. We work as allies within conflict and humanitarian exercises, and means we work with a consistent model. We can find ways of improving what we do, and in terms, if we have individual national ways of delivering services, we can impart the benefit of some of the lessons that we've learned to our colleagues. I think the benefit to the Filipino people is twofold. One is that the services, the military services in the Philippines will be able to perhaps improve on aspects that they wish to expand of their own military medical services, which will be of direct benefit to their people. But in addition, by involving multinational allies, that expands the capacity that can potentially be offered in the future with more multinational involvement in both domestic and international provision of services. The great thing about this sort of symposium is that it allows us to discuss with our colleagues in a more informal environment the way we provide service care. And I think that I've found it quite reassuring how it reinforces the strong points of what we're doing right, but allows us also to learn new ways of doing things that we have perhaps not been doing to the best of our abilities in the past. I think all the nations that are taking part actually have very significant humanitarian assistance and disaster relief roles, both within their own countries and in a more international sphere. By the exchange of information, we can reinforce our own abilities, but furthermore we strengthen the bonds between the services of our individual countries, which allow us to work more effectively as a team should the need arise in dealing with humanitarian disaster relief. I'm finding it an immensely valuable experience already. Meeting people who I haven't had a chance to interact with, realizing that there are an awful lot of people out there who think the same way that I do. And I found it a very reassuring experience. When I look at a presentation being given by one of the Americans or being given by one of the Philippine presenters, and I'm certain by my Japanese colleagues, to realize how similar what they do is to what I do. And I think that this reassures me that should I need to work with them as colleagues, it would be very easy to step into that role.